Hi, my name is Joe Bellick, and I'm the founder of Bellick Law, LLP. We are proud sponsors of the Mesothelioma Research Foundation. We have been honored to do this work for 25 years, representing people with mesothelioma and their families. And part of our commitment to our clients is to give back and sponsor research and advocacy efforts and engagement across the mesothelioma community.
Hi, I'm Trey Branham. Dean Omar Branham and Shirley is proud to sponsor this year's Mesothelioma Applied Research Foundation Conference. The 34 lawyers at Dobbs have more than 400 collective years providing legal representation to victims of this insidious cancer. We applaud the leadership of MARF and this community for its tireless dedication to finding a cure for this totally preventable disease.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.
Welcome to MesoTV. I'm Julie White, and I'm the Patient Services Director. Today, we're talking with Dr. Michael Offin, who's a medical thoracic oncologist at Memorial Sloan Kettering, where he is the medical director of the mesothelioma program. Welcome, Dr. Offin.
Hi, everyone, and thank you, Julie, for having me today.
Thank you for being here. Dr. Offin does research and clinical trials for mesothelioma. I wanted to ask you, Dr. Offin, a little bit about yourself, if you could tell us.
Yeah, of course, it'd be my pleasure. So I'm a thoracic oncologist at Sloan Kettering, focused on the treatment and investigation of patients with mesothelioma. I am the co-director on the medical side for the mesothelioma program at Sloan Kettering, along with my surgical co-director, which is Prasad Adasamili. Myself, as well as our multiple collaborators across several different disciplines, meet regularly to help manage these patients and their needs and the research. I got my start in training and fellowship at Sloan Kettering and never left. I kind of got very interested in mesothelioma, having been a fellow in Dr. Zouderer's clinic and then continuing under her mentorship during my early career. And it was thanks to that kind of tutelage and fostering in terms of the research that I was able to kind of make it to where I am today. And to be completely frank and honest, I wouldn't have it any other way. I get to meet lovely patients, get to work with the Meso Foundation regularly. I'm a member of the advisory board. So in general, I'm very fortunate to get to speak to and be involved with these patients and colleagues on a regular basis.
I wanted to start off by asking you, Dr. Offin, about research. What makes mesothelioma such a challenging cancer to treat?
Mesothelioma poses unique challenges, both from a research perspective and the way we treat our patients. Firstly, in order to do proper research, we need good model systems in the lab to try to explore novel treatment options that make sense to bring to our patients. And there have not been historically a lot of these good models. We have taken the efforts at Sloan Kettering to build out these models to kind of help push that forward. Other issues are, it is a comparatively rarer cancer diagnosis, and making sure that we have patients as well as industry partners interested in pursuing these types of research projects is another thing that we're very focused on.
When you're doing research and looking for potential treatments, where do you begin?
So in general, a lot of it has to do with keeping up to date on the literature from other cancers, looking at the genetic fingerprints of other tumors for any genes of interest that may make sense to explore in this cancer. But otherwise, a lot of it has to do with good, strong collaborations with people in the basic sciences and lab setting. So if there are certain models that we've developed or certain drugs of interest, trying to get those into the lab quickly so that we can try to explore and see if they are safe in the model systems and if they work better than other drugs.
Ah, okay. How does translational research help develop treatments for mesothelioma?
So translational research, which is what we kind of like to call lab bench to bedside, to me is kind of the mainstay of modern medical developments. That's where we come up with a scientific idea that we think may make sense to help our patients, but we need some proof before we would ever want to give it to a human. We can use cell lines in a petri dish. We can use mouse models or other types of models to see how effective these medicines are. And then using that data, we can try to explore if it makes sense to bring it into the clinical patient setting.
What role do mouse models play in this research process?
So mouse models in general, I find, are very important. We've spent a lot of energy and time trying to build out our mouse library. So what a mouse model is, it can be done a few different ways. But a lot of the times you either take a cell line derived from a mesothelioma cancer or an actual biopsy if a patient gives permission from their biopsy material. We grow it out and then we implant it into a mouse. That mouse can then grow the tumor, and we can use that tumor as a model system for treatment to try to understand how that medicine may or may not work in a person, mechanisms of resistance, and then use that information to see if it makes sense to bring it to the patient's bedside.
Yeah. Could you explain the different types of mouse models that are used in mesothelioma research and what insight each type provides?
So there are several different types of models, but in a broad sense, some of the mice have intact immune systems, while others purposely do not. Mice with intact immune systems a lot of the times are useful to figure out immunotherapy type questions, or CAR T, which is like a cellular-based therapy question, where the mechanism of how the medicine we're giving works involves the immune system. You want the mouse to have an immune system. So that's one type of model. Other models that the mice purposely don't have an immune system component are better for targeted therapies, chemotherapy type questions, genetic type questions. And so we do use a lot of those immune compromised mouse models for things like if we find a gene of interest and we're curious if a drug that can inhibit that gene would be beneficial, that doesn't necessarily directly involve the immune system, and we use the immune incompetent mouse.
Moving from talking about mouse models to human trials is an exciting step. I wondered if you could talk about how using these models helped you to develop a clinical trial that is actually open and recruiting mesothelioma patients currently.
Yeah, happy to. So I spent a lot of my time with my colleagues trying to develop novel treatment options for patients with mesothelioma. We actually wrote a paper a few years back describing our first kind of 22 models in our library of mouse derived from mesothelioma. And while we were doing that, we found that there was an increased signal for a protein on a large majority of the tumors in the mice, that protein called TROP-2. And it just so happens, again, keeping up with literature and other tumors, there is a class of drugs being developed to target TROP-2 expressing cancers. Those are called antibody drug conjugates, which I like to call kind of like a smart chemo, where the front of the molecule attaches to the protein of interest, and when it attaches, then strikes it with a warhead that it holds. And so there is an FDA-approved drug called Sacituzumab govitecan, which targets TROP-2. It's used in breast cancer. And so when we found that TROP-2 is overexpressed, we asked the question, well, would antibody drug conjugates like Sacituzumab help destroy these types of cancer cells? And so we took it to the lab with both mouse models and cell lines and found, yes, it does. We were also able to explore mechanisms of potential resistance. And then based off all of this, in coordination with our industry partners and some grant sponsorships, we were able to move this trial forward into a phase 2 clinical trial here at Sloan Kettering.
So the TROP-2 clinical trial, that you kind of told us how it's sort of emerged. Is this trial open to pleural and peritoneal patients?
So the way we designed it, it is only currently open to patients that started with pleural disease. Mm-hmm. So if a person had pleural disease and it spread to another compartment, they could be eligible. The reason we did that is because the current way we have guideline recommendations do parse it out based off peritoneal or pleural disease. And because it is a smaller trial allowing 33 patients, we needed to stick with one site of origin. With that said, if we do find effectiveness here, our plan is to ask our industry partner to allow a peritoneal cohort in the future.
What about the histology or the cell type?
I'm not limiting based on histology. That is something we'll be evaluating to see if there's different response rates for epithelioid versus not, as well as based on genomics. For instance, I plan to evaluate if BAP1, NF2, or other markers portend better or worse outcomes. But with that said, they're not criteria for eligibility on the trial.
Okay. Is there any major exclusions that patients should be aware of on this trial that would exclude them?
In general, they're pretty standard language. Patients need to have adequate blood counts and numbers to tolerate that chemotherapy backbone of the drug, because the side effects can be on par with that of chemotherapy. So we'd want to make sure that it makes sense and that people are well enough to tolerate it. The other thing on the trial is that they have to agree to do 2 biopsies. And so to be eligible for the trial, a patient has to be willing and ready to do it if the biopsy doctor thinks it's safe and reasonable to proceed.
How does the ongoing research in mesothelioma, including the use of mouse models, shape the future of personalized medicine for patients with this disease?
So in my mind and many of my colleagues, the kind of future of cancer care in general is personalization. It's not a one-size-fits-all. And I think a lot of that speaks to the fact that, again, now we have different guidelines for pleural and peritoneal, and people are beginning to understand that these are different diseases. And then within an individual disease like pleural meso, we now break it down by histology, the genomics. And so I think as we get farther down this pathway of understanding the unique nature of everybody's tumor, model systems in the lab that can faithfully show us that type of tumor and figure out, will this medicine make sense for that patient, not just this type of cancer, is where we're going. And these models and these lab collaborations allow us to do that in a more timely way without exposing patients to drugs that may not work before we have some sort of data to show that it may.
Well, this sounds like a exciting trial and another good opportunity for mesothelioma patients. And I wonder if you have any last words or any advice you want to give?
So I would say in general, clinical trials for patients and patient family members to explore with mesothelioma remains a mainstay treatment consideration for the disease. While there has been a lot of developments and now 3 FDA-approved regimens, they're all in the first line. And so trying to figure out what we can do after first-line medicine doesn't work and or improve upon first-line therapy remains our #1 need. So I would say in general, exploring clinical trials with your clinicians, with the Meso Foundation, I think is always an appropriate thing to consider. And this trial, amongst others, may make sense. And of course, I'm happy to discuss with patients if they're interested in the trial.
Thank you. Thank you for your time, Dr. Offin.
Of course. Thank you, everyone, for listening.
Thank you.